In the Latin American Working Group, we've been working since 2019 in trying to encourage and all the Latin American efforts have a space to share with everybody. I'm going to share my slides now. Okay, you can see my slides now, right?
Yes, I can.
Yeah, so in 2022, we set some objectives that we've been meeting for the first of the year. And the first thing we've been trying to do is actually increase the attendance, right? We were hit by the pandemic, people dispersed a little bit, but then we said, okay, let's try to bring new people, and let's try to bring people that are engaged in doing the work of getting into the Odyssey community. And so far, I think we have had at least 10 new people, plus the 30 that we already had on the calls usually. Then we wanted to put some new fresh faces to speak as well. And we are happy to share that even we've been able to know work that is currently being doing on Chile and Brazil on conversions, right? For example, one notable one that was presented on June 22nd was a conversion from CDAX data from Brazil. And this data is very peculiar because they have run studies with their data on 100 million Brazilians, which is amazing. And they decided that they are going to do this mapping. I believe there are some strong collaborations with Danny Prieto and for this conversion, and it's going well, and they have a wonderful infrastructure that they share. From Chile was a small data set, was a clinical and EHR data set from a hospital in Chile, and was led primarily by a master student. Was amazing. They even stood up Atlas to inspect the data and share the results. We also had a very peculiar initiative. Was this SIGTA to OMAP. It was an initiative where they launched when they did a request for help, and they crowdsourced mappings for one of the main Brazilian vocabularies that is called SIGTA to OMAP. And more than 100 people decided to enroll in this crowdsourced mapping and using the Odyssey tools, right? Using Usagi. They were having a lot of very interesting threads on the Odyssey forums, all in Portuguese. And I saw a lot of people even making the jump, translating some things and helping along. So really appreciate all the help of all the Odyssey community in making this happen. Also, we had a presentation earlier in the year about the first prediction model that we want to run as a network study on the community. And we actually have, I'm going to skip here. We actually have a first draft of this protocol internally circulated among the working group members, and we are going to start circulating this draft for this study with the entire community to receive some feedback and hopefully get the ball rolling with some Latin American data. Also, we said that we want to build more resources for the community. And on that regard, Maria Teresa has actually created a course completely in Portuguese. She already offered a first version of the course, and the second one is going to be open in the next quarter. Next quarter, and is in a great partnership with the Brazilian Society of Informatics, of Health Informatics. So it's even the first cohort of people is really engaged on collaborating, and they are part of the people that actually led the effort of the crowdsourced mappings. Also, we said that we want to keep talking about Odyssey. We were invited to to a national event in Colombia. And also there is another talk that we're going to have on Brazil, on the 7th Latin American Forum led by the Institute for Healthcare Improvement on Brazil. And there are others that that I forgot to put here. And one of the I'm talking about here, we didn't put it as an objective for this year. We should have, and is that so far reported there are 4 conversions that are happening right now. And I'm also happy to report that my own institution, Universidad del Norte, we just started the conversion of our hospital data, and we have I believe close to 600,000 patients, and it's going to be really exciting to join the effort to the other centers that are leading these on Latin America. So the next call, that is going to be August 24th, we're going to have a company and Fora Health presenting a conversion of the data that they have been able to gather on behalf of a partner in the United States. And they are going to present the efforts of leading this next week. So everybody is invited for that. So that's it for my update. I think it was very brief. But if you have any question, feel free to ask on the chat. Thank you.